Hello, I'm Jim Walsh. I'm the medical director for the Robert Packer Hospital Mansfield University Respiratory Therapy Program. I'm also a practicing pulmonologist and intensivist, and I've been practicing for close to 30 years. I served many roles in medical education. I also am the medical director for the critical care unit and have been the medical director for the respiratory therapy department here for many years. I would like to encourage anyone who has an interest in science and medicine to consider respiratory therapy as a potential career. Respiratory therapists are an integral part of our ability to take care of people with pulmonary disease and to take care of patients who have critical illness in an ICU. We rely on respiratory therapists for their technical expertise and for their skill in assisting us in managing ventilators, doing procedures such as bronchoscopy, and teaching patients about management of their medications and about understanding chronic lung diseases. Respiratory therapists also help us with pulmonary rehabilitation, which is essential for patients with lung disease, and often work in a home care setting, providing devices such as CPAP and BiPAP and oxygen to patients at home with chronic respiratory disease. What I can tell you is that pulmonologists and intensivists would find their job much harder without the skill of excellent respiratory therapists. We've been lucky enough at Robert Packer Hospital to have a training program for respiratory therapists and get many very skilled respiratory therapists joining our staff from that program. We are excited now because we have moved this program to a bachelor's degree program, which we feel is going to give enhanced expertise to students as they pursue the field of respiratory care.
My name is Jesse King. I'm currently a respiratory therapist at Robert Packer Hospital. I'm a graduate from the Mansfield University Respiratory Therapy Program. A respiratory therapist is technically a cardiopulmonary specialist. We work in a variety of different settings, so from the hospital to maybe an outpatient setting to even in the community. We work with a variety of different patients that require different needs, different age populations, from kids all the way up to adults. Respiratory therapy is a great career if you do enjoy helping people. You have the opportunity to do that on multiple occasions every day. And even furthermore, you can help add value to the whole healthcare team when providing patient care.
My name is Roger Lathrop. I'm the Senior Director for Internal Audit and Compliance at the Guthrie Clinic in Sayre, Pennsylvania. I am a graduate of Troy High School in Troy, Pennsylvania, and I attended the Robert Packer Hospital School of Respiratory Therapy through Mansfield University. I graduated there in 1993. Respiratory therapy is one of the lesser known heroes of the healthcare team that really focuses on cardiopulmonary care, the heart and the lungs. The program at Mansfield University provided me with excellent clinical skills as well as the ability to pass the national registry on my first try, and led me to a very exciting career in respiratory therapy. Foundationally, the program through Mansfield University and Robert Packer Hospital is exceptional. It received year-over-year national accommodations and awards for the excellent clinical skills that the students provide, a fantastic pass rate on the national boards, but more importantly, they turn out very positive respiratory therapists who make a difference in the communities they serve. If you're considering a healthcare career and you're strong in math and science and you really want to help people, respiratory therapy is the program for you.
My name is Sheila Merrell. I am the program director for the Mansfield University Robert Packer Hospital School of Respiratory Therapy. I have been in this role since 2014. I also am a graduate of this respiratory therapy program. I graduated in 1994. So it was kind of, wonderful that I got to come back and be the program director in the same school that I learned this great profession of respiratory therapy. One of the great things about being a respiratory therapist is that every day can be different. You aren't necessarily just stuck working on one floor. Today, you may be assigned the intensive care unit and taking care of those patients that are on ventilators. Tomorrow, you may be working in the neonatal intensive care unit, taking care of the babies. Or you may be working in the pulmonary function lab where you're helping patients come in and get breathing tests done. Another area is sleep laboratory, where you can test people for sleep breathing disorders. I think that's one of the great things about respiratory therapy is that there's so many different niches that you can focus on, or you can have lots of opportunities of changing it up every day. Respiratory therapists also play an integral role in traumas and in the CPR team. Respiratory therapists are generally one of the first people at the patient's bedside when they need emergency care, whether that be CPR or whether that be helping out with a traumatic event, like an ambulance coming in with a trauma or a helicopter coming in with a trauma. If the patient requires high-end ventilatory or breathing management, then the respiratory therapist may be part of the transport team to take the patient from one hospital to another hospital. If you're looking for a great, fulfilling career in healthcare, you can have that locally here within Guthrie and Mansfield University.